My name's Wanda Harris. I'm a mammography coordinator for Blue Ridge Healthcare, and I have been with Blue Ridge Healthcare for 4 years, but I have been a mammographer for about 25 years. Mammography is the single best way we have to detect breast cancer, and it is a simple procedure that most women do not like to have, but it's a necessary evil, I guess you would say. When you have a mammogram, you come into the room and you will have to disrobe. We try to do one side at a time, try to maintain modesty as much as possible. And they have to have removed deodorant, lotions, or powder from the breast area. Those things cause artifacts, and that affects the quality of the image. So they do have to remove that, and then they will come to the machine, and the machine has a compression paddle on it. We position the breast on the machine, and we have to compress the breast. And we do it to a level where it's taut and tight, and try to make sure that it's as comfortable for the woman as possible, but we don't want to jeopardize the quality of the image. So if we need to have more compression, we'll encourage them to take more if necessary. A screening process, mammography, takes 10 to 15 minutes. After a screening procedure, a patient will leave and the images are sent to a doctor's workstation where the radiologist interprets the images. And he will generate a report that will be sent to the physician by fax. And then the next day, a letter is printed that is mailed to the patient with their result in lay terms that gives them the result. If there's an abnormality detected by the mammogram on screening, the patient's notified by letter, and the physician's office is notified, and they will contact their patient and set up a diagnostic mammogram, which is to determine what is going on with that breast as far as the abnormality. It can be in the form of spot cone compressions or breast ultrasound. And once those images the additional views are performed, then the radiologist can determine what steps need to be taken next, whether it be a follow-up or a biopsy, or they can be actually cleared with a negative result. One of the things I think is confusing to women is the difference between screening mammography and diagnostic mammography. Screening is for women, basically that, to screen for an abnormality, which means they have no clinical findings. But if you were to have a lump or something abnormal, pain, something of that nature going on, then we recommend a diagnostic study, which means you need to see a physician and get an order. Have a clinical breast exam also by that physician. And that's the difference. There's a lot of confusion about that. We are very fortunate that we have the state-of-the-art technology within our healthcare system. We have, of course, digital mammography. We have breast ultrasound. We also have breast MRI. If a patient needs a biopsy, we have stereotactic biopsy, and we also help surgeons with breast localization biopsy and core biopsy under ultrasound guidance. The patient can also have an MRI guided biopsy if needed. We have the technology to find the cancers, but we also have an excellent staff at the Cancer Center at Valdese and Grace that can help fight the disease. I have been a radiologic technologist for, 32 years, and 25 of that has been dedicated to mammography because I've found that that's my heartstring and that's my work that I feel like God has led me to do, because I've had several friends I've lost to breast cancer, and it just tugs at my heartstrings so that it makes me be a better employee and better at what I do, because that's my heart's work. I'm very satisfied with what I do. I'm very proud of what I do, and I feel like I am doing something good for these women, even though they may not think so. But it's just very satisfying to see us find something early and know that they're going to survive. And that's what we're here for. is to catch things early.